All right, good morning, everyone. Today we need to talk about mucous cysts, are small fluid-filled sacs that form on the fingers. They are associated with osteoarthritis and usually develop in patients 50 to 70 years old. These cysts appear between the last joints of the finger and the bottom of the fingernails. Now, mine's on the first joint, to begin with, like I just showed you before, right here. So, again, none of this is normal, but whatever, right? All right, then people also ask, what is the cause of a ganglion cyst? The cause of a ganglion cyst is not known. One theory suggests that trauma causes the tissue of the joint to break down, forming small cysts that then join into a larger, more obvious mass. The most likely theory involves a flaw in the joint capsule or tendon sheath that allows the joint tissue to bulge out. So I had some kind of joint damage, it looks like, on the bottom of my finger, as in a aikido, aikido or jiu-jitsu type technique. Also known as wear and tear arthritis, osteoarthritis causes cartilage to wear away. It appears in a predictable pattern in certain joints. Rheumatoid arthritis is a chronic disease that can affect many parts of your body. It causes the joint lining synovium to swell, which causes pain and stiffness in the joint. Are ganglion cyst hard? The fluid-filled sac may arise from a joint or tendon sheath. These cysts can be very small or enlarge to become unsightly. They are not cancerous and may arise as a single cyst or have multiple lobes. Some cysts feel quite hard and may be mistaken for a bony prominence. Do ganglion cysts hurt? The size of a cyst can fluctuate, often getting larger when you use that joint for repetitive motion. Pain. Ganglion cysts usually are painless, but if a cyst presses on a nerve, even if the cyst is too small to form a noticeable lump, it can cause pain, tingling, numbness, or muscle weakness. What age do you start getting arthritis? It often starts when a person is between 40 and 50 years old. Women are 3 times more likely to be affected than men. Rheumatoid and osteoarthritis are two different conditions. Rheumatoid arthritis can occurs when the body's immune system targets affected joints, which leads to pain and swelling. Are ganglion cysts dangerous? Ganglion cysts are the most common masses or lumps in the hands. They are not cancerous and in most cases are harmless. They occur in various locations, but most frequently develop on the back of the wrist. Yet I have none there. These fluid-filled cysts can quickly appear, disappear, and change sizes. So I probably shouldn't worry about them. Do ganglion cysts ever go away? The cause is unknown, but it is thought that small tears in the tendon membrane or joint capsule allow the contents to squeeze out. In many cases, Ganglion cysts go away by themselves without the need for medical treatment. Treatment options include surgery or draining the cyst with the needle. Rheumatoid arthritis also causes pain and swelling in the joints. Usually the small joints of the fingers and toes are affected first. The disease is symmetrical, meaning that if your left index finger is swollen and painful, you'll usually have the same symptoms in the right index finger. If arthritis, which affects the joints, is causing you pain, you may feel and see swelling and redness from inflammation. Inflammation eventually damages the joints in the hands and knees. The pain and stiffness may be felt on both sides of the joint. Ganglion cysts are the most common mass or lump in the hands. They are not cancerous and in most cases are harmless. They occur in various locations but most frequently develop on the back of the wrist. These fluid-filled cysts can quickly appear, disappear, and change size. Why do they call a ganglion cyst a Bible cyst? Interesting, but okay, let's read that. Ganglion cysts are the most common mass in the hand and wrist. Sometimes excessive fluid forms pouches called ganglion cysts. We really don't know what causes them, although they might be a genetic and or biological cause. Some cysts appear when the joint is inflamed due to arthritis. What does ganglion cyst mean? A ganglion cyst is a fluid-filled, non-cancerous lump that usually develops in the wrist or hand, but some occur in the ankles or feet. When a ganglion cyst presses on the nerve, it can be painful, and depending on its location, a ganglion cyst may restrict movement. How would you describe arthritis pain? These can occur. Joint pain that occurs on both sides of the body, such as both feet, ankles, wrists, and fingers. Significant stiffness in the morning that persists for at least an hour. Aching muscles all over the body, weak muscles, feeling tired or depressed, losing weight, and not having much appetite, slight fever. I've lost a little bit of weight. I don't know about weak muscles, but I ain't been lifting weights. Maybe I should go back to lifting weights a little bit. Mm-hmm. How are you diagnosed with arthritis? To diagnose arthritis, your doctor will consider your symptoms, perform a physical exam to check for swollen joints or loss of motion, and use blood tests and x-rays to confirm the diagnosis. X-rays and blood tests also help distinguish the type of arthritis you have. Can you move a ganglion cyst? Sometimes patients say they remember injuring the hand or wrist several weeks before noticing the cyst, but most patients can remember a specific event. Cysts are usually round and firm. You can usually feel the smooth edges of a ganglion cyst, and you can often move the cyst around under the skin with your fingers. What is a cyst and what causes it? More detail and supporting information is in the main article. Cysts are non-cancerous and have a sac-like structure that can be filled with fluid, pus, or other gaseous material. Cysts are common and can occur anywhere on the body. Cysts are often caused by infection, clogging of sebaceous glands or around earrings. All right, that's enough of that. Anyway, that's what ganglion cyst is. That's probably what I have.